We are continuing to celebrate and bring awareness to Breast Cancer Awareness Month, and I am so happy to be outside because we have the mobile unit from Metro Health that we're going to be talking about getting those mammograms and making sure you're getting the screenings. But right now I'm joined by the Executive Director of Metro Health Cancer Institute, Dr. Natalie Joseph. I thank you for joining me.
Thank you for having me.
You've become a staple here at Fox 8 this past month. We appreciate you sharing your knowledge. I think one of the most important things is just reminding women to get the mammograms. This is so important because it can predict something very early on.
Yes, that's absolutely correct. So the reason why we really stress the importance of screening is that we're able to detect cancers before you have a chance to even know it's there. So when it's very small and it's only seen on a mammogram. And that's important because it really affects the options that you have for treatment and your outcome. Outcomes is so much better when we find cancer early. So it truly does save lives to get screened.
What about the screenings? What are the current guidelines for women who should be getting one and when?
So there are many different screening guidelines out there. Although we follow the American Cancer Society guidelines, women should really start screening at age 40 and get their mammograms annually. And they can continue to do so as long as they're in good health. Some women do choose to go every other year once they get a little bit older, and that's for average risk women. For people who are high risk, we actually recommend that they start screening perhaps earlier, and actually they should get a risk assessment with their primary care physician, maybe even starting in their mid-30s so that they could see if they would benefit from genetic testing or other treatments that might help to decrease their risk. And so that's really important to have that conversation with your primary care doctor.
So genetic testing is something they can do. Getting that risk assessment, I feel like now, and I'm so happy to hear, I think it's becoming more and more commonplace that women know about getting one. When I went through my situation, I was talking with people about it and they didn't realize they could get a risk assessment. Can you explain kind of what that is?
Yeah, so it's really just a more comprehensive way to assess your risk factors. And that could be things like your family history, whether or not you've had other biopsies, whether you've had hormone exposure, your breast density falls into that as well. And then based on that, there are different models that we use to calculate risk, and any woman who's over 20% lifetime risk is considered to be high risk. And that may make you eligible for things like getting extra screening with either MRI or other modalities as well, perhaps using medications that can reduce your risk, and sometimes people may even consider things like risk-reducing surgeries as well.
I think it's so important because density in itself could make you high risk, correct? And so a lot of people, even if they don't have a genetic link or a family history, that's what made me high risk. And insurance did cover my MRI then at that point. So that extra testing is what ended up catching it and saving my life.
Yeah, and you're absolutely right. So density is an independent risk factor for breast cancer. It's thought for a couple different reasons. One is because when your breasts are dense, it's harder to find subtle abnormalities on a mammogram, but also because you have more of that fibrous, dense epithelial tissue, there are more cells that potentially could evolve into cancer. For women who have dense breast tissue, we do notify you that you're dense, and that does, you are eligible to get supplemental screening, and that can be an MRI, or it can, at Metro Health, for example, we use automated breast ultrasound. But one thing we do recommend to women is that they do check with their insurance companies to make sure that they have coverage, because not all insurances will cover for it. Okay, but you are eligible to get it.
Okay, and then I know there's always new wonderful things happening at Metro Health, new advancements taking place, and it's exciting to hear that kind of thing. And there are some new ones in advance in the way of breast health.
Yeah, so one of the things we're most excited about is that we're going to be opening our new Center for Breast Health at main campus in April of 2026. We're excited because not only is it just a wonderful space, but it will be really allow us to elaborate on the multidisciplinary and comprehensive care that we offer to women with all types of breast disease, whether that's cancer or benign disease. So they'll be able to have the full spectrum of state-of-the-art breast imaging, as well as access to all of our clinical services, seeing our surgeons, our oncologists, getting risk assessment by our genetic counselors, our work with our social workers, and all of those other support services that go into how we take care of our breast patients. So we're super excited about that.
I'm so glad you're here and addressing this, because I think sometimes we just need to know to ask the questions. You know, you have to be able to ask the questions, as your doctors will give you the answers that you need. And being our own advocates is so important as well in that process. And having this as part of a tool in your belt, so to speak, really gets mammograms and that access out to the community in ways that might not have been there before.
Yeah, that's absolutely right. Although we certainly try to do our best to kind of tout the importance of screening, only 60 to 70% of women who should be screened are screened. So we still have a lot of work to do. So having things like the Mammo Van gets us out into the community and gives women other opportunities that they may not have. We recognize that sometimes it's hard to take off work and go get your mammogram, so we're bringing it to you.
I love it.
That's really the whole importance of this.
We'll learn more about this coming up in the next hour. We're going to go inside, so make sure you stay tuned for that. Dr. Joseph, thank you so much for what you do and for being here today.
Great,
We appreciate
thanks so much.
it.
All right.
We're back with more New Day after this.